What I started with is listening. So us as educators being open to being able to hear that feedback. Don't wait to the end. So get that feedback and that response as you are going throughout the semester, as you are going throughout that clinical experience, as you are going throughout that period of fellowship training. The minimum you may have set up, or let's say in a fellowship training for midterm and final, but there's nothing stopping you from getting additional feedback. So now, I know to pause and go, how do you feel about this?
All right. Welcome to Hands On, Hands Off, where we explore the minds shaping the future of manual therapy and rehab. I'm your host today, Moyo Tillery, and we're thrilled to welcome Dr. Myra Meekins, a physical therapist, educator, and thought leader in orthopedic manual physical therapy. Dr. Meekins has been at the forefront of integrating motor learning and behavior change principles into clinical education, challenging the old adage that practice makes perfect. So today we'll dive into how clinicians can move beyond repetition and into purposeful, transformative learning. So let's get started. Dr. Meekins, welcome. To kick things off, can you share a bit about your journey into physical therapy and orthopedic manual physical therapy?
Sure. Thank you so much for having me. So I began my physical therapy career in Nashville, Tennessee. I graduated with a bachelor's in physical therapy from Tennessee State University. From there, I went back home to Memphis, Tennessee, where I worked hospital based. So that was my first job, a geriatric hospital, where I had the opportunity to rotate through acute care, skilled nursing, rehab, and outpatient to get a variety of settings. But I always knew that outpatient was where I wanted to end up being my primary home. So after a couple of years, I transitioned to a different hospital where I was primarily hospital-based outpatient. So if you've worked in that setting, you can get a ACL injury, you can get a stroke, you can get an amputee, you can get a COPD pulmonary rehab. So you get really good at seeing function and what's the main thing that needs to get this person to meet their goals versus getting too caught in the weeds. So did that for about 4 or 5 years. From there, I eventually started working in occupational rehabilitation for about 7 years. And so during that time is when I had the opportunity to complete a manual therapy certification and fellowship through Manual Therapy Institute. I did their Detroit program and did my fellowship hours in Austin, Texas with Peter Kroon. Also during that time, I had the opportunity to become board certified in orthopedic physical therapy. I caught that learning buzz and went back and got my transitional doctorate of physical therapy from Regis University. And then eventually I learned a lot about movement diagnosis and movement system impairments during my manual therapy fellowship, and a little bit about Washington University and Shirley Sarman. And so I took some coursework through the APTA and learned they had a fellowship there. So I applied and was able to do a 1-year fellowship at Washington University School of Medicine in St. Louis, learning movement system impairments. From there, I transitioned to teaching, first at Arkansas State University for almost 5 years. The past 10 years, I was at University of Tennessee Health Science Center in Memphis, Tennessee. And I have recently, as early as January of 2025, started at the University of Memphis, which is developing a doctoral physical therapy program where I'm having the opportunity to help with developing the curriculum. And I forgot, my PhD was from Rocky Mountain University of Health Professions, so I completed that in 2020 and did a little certification in health and wellness coaching, which is kind of contributed to some of that behavior change and using some of those techniques in teaching and helping to drive deeper learning.
Yeah, no, that's great. Thank you, Dr. Meekins. And I love hearing about your story and your path. It's rich, it's inspiring. And we talked about this a little bit, which is how much we have in common, thinking about our work in occupational health and at Concentra, where I spent, a couple years as well, and training through MTI. It's been something that we have in common. And obviously, too, now moving from academia to clinical, or from clinical practice to academia. But back to you, from clinical practice to curriculum development, and some of your background training, like your PhD, driving some of your interest in this work. You've worn and continue to wear many hats. When we first started this discussion, you mentioned that you have an interest and a passion for building or for bridging the gap between research and real world clinical application of OMPT principles. And more importantly, the clinical impact of all of these things put together. So, can you share a little bit about what has inspired your path to doing this work a little bit more? You touched on it in your PhD work, but can you tell us in detail, maybe in more details, about what has continued to inspire you into doing this work?
Well, yes. Well, my first inspiration was in PT school. It's knowledge, given to you by a fire hose. And so then when I got out and started practicing, it was like, oh, I needed to retain that information. And so, I was really passionate about helping my patients get better. And so, at that time, I was, a little insecure. You know how sometimes we have a little imposter syndrome
Sure.
about my foundation. And so, even though now in 2025 I have this big alphabet soup behind my name, it wasn't because I wanted to be super smart and
Mhm.
stand out from the crowd. It was I was on a journey and a path to really find out what I need to know to get my patients better. That if my patient didn't get better, it wasn't if they went across the street to the next clinic, they would get better. So I wanted to do everything I could to really learn, and so that's really what started my journey. And so as I was going through that journey, I learned all of the greatest things about evidence-based practice and
Mhm.
what does that look like actually in the clinic. So, really developing that toolkit, that teaching someone how to fish was very impactful for
Mhm.
me. But also, what I learned as I was going through the journey is um, a lot of academia um, enjoy getting into the the details
Sure.
of of the discussion, the um, rigorous debate. That's the one thing of the evidence that's there versus the therapist Thursday at 2:30 that's trying to help Miss Jones be
Mhm.
able to sit through Sunday service
Mm.
or help Mr. Smith be able to, stay on his job a little bit longer,
Mhm.
aren't necessarily arguing in those details. So some of my passion was how can I take this knowledge that I'm learning
Mm.
and translate it in a way that's helpful for my colleagues, for students, for patients. That's very real and very helpful, and I can see it within treatment sessions versus it being so abstract, which sometimes it can be when you go to conferences or you're in graduate school and those types of things.
Yeah, no, that's an excellent point, because that's the purpose. That should be the driving factor of, like you said, the alphabet soup. Is, at the end of the day, the letters are meaningless if you can't impact patients and outcomes. And I love that, and I think it's clear to me that your work is centered around both evidence and empathy, which brings us to another area that I think is central to both, entry level practice, but also advanced clinical practice. And so I want to move us toward the discussion that we're here to kind of dive into a little bit more, which is that motor learning. I think, I'm really excited about this conversation with you because I think a lot of clinicians, early clinicians or seasoned clinicians, as evidence continues to change, we kind of struggle to bridge that gap as things continue to evolve. So, a lot of what we talk about in OMPT practice is like refining movement patterns, and it's psychomotor based, to your point, and optimizing and facilitating neuromuscular control and things like that. How do you see motor learning principles kind of shaping the way we approach not just the hands-on care, but how we approach OMPT education? So whether we're educating OMPT educators themselves or fellows in training or DPT students, can you just share some insights on what successful motor learning looks like for a student? It can be, students or everyone. You and I are students, DPT students, fellows, educators. What does successful motor learning look like for us learners?
So one, most of us are familiar with the traditional um, theories of motor learning and the repetition and the time it takes to master a task.
Mhm.
So versus just getting the initial components together, and then of course the practice, the was it the 1,000 repetitions.
Mhm.
Um, so it goes from unconsciously incompetent to consciously incompetent to eventually that mastery of unconsciously competent. And so, as a DPT student, our main goal is for them to be competent, learn the techniques, be safe, and have a strong foundation upon graduation that they can build upon. Versus a resident. Again, now I have that foundation. I want to focus in a specific area of practice so I can refine and become a little bit more purposeful, intentional with my examination, my evaluation, and how do I use diagnoses, movement diagnoses, to direct my care versus a fellow or fellow in training with that motor control. At that point, most of them should have that psychomotor skill. Is a focus of that refinement of how I want to practice, really delving into the complex and into the gray um, in order to develop that mastery. So, um, with motor control, when I presented in 2023, we talked a little bit about the optimal learning theory, which is not replacing traditional motor learning theories, but just contributing to that. In addition to what we know, we also need to look at psychosocial contributors. So the influence of positive expectation. So um, I can't speak for you, Moyo, but for myself, when I was going through my training, um, it was, in the 90s, in the thousands, where, it was a little bit more strict, a little bit more, you need to do it, this is right, this is not.
Right.
And I'm actually someone that thrives with that because
Same.
I rise to to that level of challenge and know that I know. However, the 2025 student needs a little bit more of an environment that feels safe.
Mm,
And so, in the optimal learning therapy, having positive expectations,
mm,
having autonomy to be able to make choices,
mm,
you having external goals and expectations for motor learning, they have found that that increases motor learning as
mm,
well as deeper learning retention. So, to bring this back to learning psychomotor skills and orthopedic manual physical therapy, um, those days of do it my way and that's the only way while yes, you can learn a technique in order for you to optimize and master it, we do need to address these psychosocial skills. These high level of expectations aren't so high that they aren't achievable,
Mhm.
but they're clear, but they're also affirming.
Mhm.
So you do and you will be able to master these things. Okay. And so the combination of using those things, whether it's a DPT student, whether it's a resident, whether it's a fellow in training, can be very impactful for learning these skills or competencies that we want them to be able to graduate with.
Yeah. No, I love that. There's so much there, right? You talk about purposeful refinement. I love that. I think that's a wonderful, definition of OMPT practice, and, understanding that we are educating diverse learners now. We've got, second, third career individuals maybe coming into our profession, non-traditional students, and then you still have your traditional students. So like, motor learning and teaching motor learning has got to be adaptable in that realm because your learners are also diverse. So I love that, preparing students for, the real world diversity of not just who's in the room, but of practice, I think is really important. So thank you for um, speaking to that. I do want to kind of go back and call out something you said, which is really powerful. You said address the psychosocial to address the psychomotor. And I think that's a powerful foundation for motor learning. And maybe we can even call it contemporary motor learning, because I agree with you. Motor learning, I completed fellowship training not as long ago, right? It was 2017. But even, a couple years later, 7, 8 years later, teaching and learning and the science and the art of that, I can see it changing, especially now that I'm in academia. So I have a deep appreciation for what you just said there, which is you cannot separate the psychosocial from the psychomotor. That is pivotal for what we're trying to do. And, it's clear that when we shift how we teach, even with our patients, we haven't talked about patients yet,
Mhm.
and patient education, that's probably another podcast, but we shift how we teach and we shift how students show up to learn, and cultivating that environment is so important. I love leaning into your expertise here, um, in this area. I wanted to ask you, and I guess this is sort of a shift, a parallel shift in what we're talking about. Um, I want to talk a little bit about curriculum. So I know that you are in this space right now. You have led efforts to integrate content and create themes and threads, like we spoke about Dr. Sarman's movement impairment systems, evidence informed practice, professional identity formation. What is your approach to designing learning experiences that stick? And this question comes from the fact that I think we all know that when learning is meaningful, it sticks. But let's say you have a cohort of 100. How do you make learning stick for all 100? I'm selfishly asking for myself, right? But I want to bridge the gap again between like evidence, curriculum, didactic, clinical practice, and impact. I feel like you have this broad experience. You do have this broad experience across the spectrum. And I want to know, what is your approach to designing these types of learning experiences?
So, one, let's put it on the table. It is hard.
It is hard.
So, I'm not saying I have the answer, but I can share with you,
Yes.
our thoughts and techniques, as well as, like you say, what is some of the evidence is saying. So, one of the things, since we were talking about psychosocial a little bit,
Mhm.
I do teach that course. In the past, it's been the very first course in the term. And I have students to develop mission statements.
Mhm.
And so a couple page paper on that in regard to what their why is. And
Mhm.
so not just why for PT school, but why for your life. What are your short term goals and your long term goals for your for your life?
Mhm.
Okay. Because that is what's going to help. bring you through as you're going through challenges and difficulties. So when we talk about making learning stick, you know, having that intrinsic motivation
Mm,
is extremely important. So, you know, they need more than you learn this because I told you to learn it or just take my word for it. So, how does this apply to their personal goals as well as professional goals? How can they see a real life application with that?
mm,
Of course, there's repetition and overlay and sequencing that, of course, needs to occur. So just because they learned about a principle in one course doesn't mean that you don't teach it in other courses. So they need to hear it multiple times in different perspectives, in different contexts. So, you know, some curriculums are very purposeful in integrating content so it's not so siloed, which can be very extremely helpful. And students definitely love cases and scenarios and authentic. So, those who have the opportunity to be able to do simulations, that can be very helpful for helping to make things stick. You know that the APTA and ACAP and the Education Academy for APTA are working on competency-based education, which, you know, allows that continuum of learning where people can kind of learn at their own pace, and more individualized, but every student has to show competency for every um, task or entrustable professional activity. And so I think that's challenging, but
mhm,
I do think those are things that are extremely helpful for developing skills for competency in the case of DPT education, and then mastery for resident and fellowship education. So, really attaching it to their why, positive expectations. So, the first day in my spine class, I make it very clear I do not care if you're going into pediatrics or aquatics or
mm,
neurology. Everyone in here will be demonstrating thrust and non thrust techniques. You will do it. But I also believe everyone in here has the tools to be able to do that. I'm going to teach you, I'm going to allow enough practice time. You will be able to do that. So while the students are like, ooh,
mm,
you can also see that wheel turning in regards to, okay, how do I need to align myself in order to make it happen? So being very clear with our expectations, allowing that practice time
mm.
um, can be very helpful for skill mastery and making it stick.
I love that so much. You said you didn't have the answer, Dr. Meekins, but I think you just gave me an answer, which is, when you have a room of 100 learners and, you want to set everyone up to be successful, how do you do that with 100 different ways of learning is clear expectations. This is not different from what we see in the clinic. It's level setting and saying, these are the things that you need to be able to do by this point, and this is how I'm going to get you there. And I love that. I think, sometimes we reach for things that are more abstract, but at the end of the day, it's just about giving the learner their tools and saying, this is what's expected of you, and this is how I'm going to get you there, and just setting that expectation. I love that.
Yeah.
And, even in you saying that tying it back to your why, this comes back so much, and I it always makes me a little bit, maybe sad is the word, is because as we're educating, semester one DPT students, and we hammer on your why, remember your, so I'm in admissions, I read a lot of like, why do you want to be a PT statements, and reminding students about their why. They, sometimes they don't connect that to learning, so I love that you're very intentional about that. And um
I
when it, yeah,
No,
yeah, when
I
it,
also want to say, because that was a focus on the student, but
exactly.
us as teachers and instructors or CIs, we need to be flexible. We need to be able to adapt to the variety of learners or the diversity that's in your classroom or in your clinic. Everyone does not learn the same. And so sometimes that can be hard. I learned it this way, so you should be able to learn it this way.
Mhm.
Or I'm only going to do traditional lectures, or,
Mhm.
so we are doing a disservice as well. Instead of, we don't want to just teach content, we want to teach the learner that is in front of us. And so with that, that does put some onus on us to
Yeah.
be adaptable, to listen, and as well as being in touch with our why. Why are we doing this? Why are we in front of these students? If it's the purpose is to improve the profession into that generation, then sometimes reflecting on that, like we ask the students to do, can make it easier for us to pivot and adjust to the student that's in front of us instead of the student that we would like to have.
Sure. I love that so much. And you took the words from me. I know when we chatted a little bit before this session, we talked about how, it's one thing to teach motor learning and repetition and those things to students, but how do we empower educators then to do what you're saying? Pause and reflect. Are there moments or triggers or times where you would say, hey, take a step back, think about what you're doing, how you're doing it? Like, what are signs and symptoms for me as an educator to step back and get out of my way, to teach my students? I know some of the things we talked about were, practical things like low stakes assessments for students just to gauge where they are with the content we're delivering. Um, do you have ideas on other practical solutions and resources for, entry level DPT educators, but also at the level of the fellow OMPT educators? What can we do to be better? How do we become more reflective educators, thinking about all of these principles and bridging that gap between the learner and us, the instructor? What can you help us, Dr. Meekins?
Again, I'm laughing because if my students were watching this, they would be like, maybe you should be listening. Um,
We're all guilty and trying to get better, right? So,
Right. Like I say, it's a journey.
mhm,
And as well as once you think that you think you've got it, then that's a problem because you can't learn
sure.
anything else. So with that, what I started with is listening. Okay.
Mm,
So us as educators being open to being able to hear that feedback. So sometimes we're like, especially of those that are in entry level education, sometimes those course evals. Um, can be a little spicy, but you
sure.
have to learn how to eat the meat and throw away the bones,
Hmm.
as my mom would say. So one, being open to feedback. Don't wait to the end. So get that feedback and that response as you are going throughout the semester, as you are going throughout that clinical experience, as you are going throughout that period of fellowship training. So the minimum you may have set up, or let's say in a fellowship training for midterm and final, but there's nothing stopping you from getting additional feedback each week, or as students are learning during that time, because it gives you time and room to be able to pivot. So I do like to use polling software because early in my education, students wouldn't say anything. So I'm teaching. Nobody's asking. This is great. And then I would get the exam. I'm like, this is not great.
Yeah.
So now, I know to pause and
Yeah.
go, how do you feel about this? Really? All right, I'm
Mhm.
going to throw up a couple of questions. Let's see.
Mhm.
So I'm forcing them to engage and go, okay, they don't. And usually giving them a little space and room, as well as we talked a little bit earlier about that environment
Mm,
for them to ask the question without feeling it being punitive.
mm,
Us making sure that the other students are supporting that
mm.
learner as they go. So then that way, those robust discussions can have, because we don't know what's wrong unless we have a space where students feel free to be able to tell us, even if the answer is, oh, I really didn't read that, or I
Right.
focused on that wrong.
Mm,
So we have to be able to hear it. We have to be able to ask frequently with that. And then we have to be open
mm,
to change. So
mm,
for myself, I had a colleague to help me when I first started teaching. I'm someone that I get the main points during the lecture, and
mm,
then I go home and then I read through it. I read my book, and then if I have other questions, I would ask the next class session.
mm,
But my colleague, she would say, "No, Myra, I try to learn it as much detail as I can while I'm in class, so
mm,
that way I don't have to study as much afterwards." And so that was a paradigm shift for me because I was teaching, I was hitting high points, but um, um, I was not going in as much detail
mm,
because I was assuming that students were learning the way I learned. So
mm,
once I started recognizing there's various ways, then I changed the way that I was relaying the content, and then I would check in: is this enough? Do you all need more?
mm,
And so, to get back to your original question, how do we help these students to be able to retain the content?
mm,
It's staying close to the material, staying close to the students, regular formative as well as summative assessment, and then, going along with this competency-based education trend, making sure these assessments are valid.
mm,
So, are the assessments I'm doing actually reflective of their actual performance?
mm.
So, that way we have truthful information that we can make better decisions.
There's everything you're saying is so rich. There's so much there, and I'm kind of internalizing this as I'm listening because teaching in a hybrid program that offers maybe some unique challenges when we talk about psychomotor skills, where we encourage students to practice immediately. Staying close to the material, like you said, even though we're not physically in person until a midpoint in the semester where they've got a ton of information to filter through. um, but I love what you're saying there because if we fall into the trap of maybe teaching the way we learn, then we're doing a disservice to our students. And I think that's something that in itself, if you reflect on that alone, seems to be the answer to all our problems, right? Like staying close, getting the feedback. And this is I love the parallel between the educator side and the clinical side because a lot of what you say is in parallel with what we say to students when they're in the clinic or fellows when they're training, which is you got to be adaptable. You used that word a couple minutes ago. You have to pivot in the moment. And this is sometimes I think the educator does think this doesn't necessarily apply to them because I've already course planned through the semester. This is what I'm doing. This is how I'm doing it. You got to pivot in the moment. And failing safely, you have to create an environment where students and fellows can fail safely. I think that's a lot of what you seem to have just spoken about. And that's a place where I love it connects the psychomotor and the psychosocial so beautifully and so seamlessly. um, that I love that we've come kind of full circle on separating all of these components and trying to bring them together, so thank you so much for that. I know that you, like I said, wear many hats. And, just before we close, I was wondering, in addition to all the insights and, your passion and your interests and your work that you've shared with us, um, what are you excited about next? What's next for you? What are you up to before we wrap up? Any projects you're excited about working on or any upcoming interests, I guess life interests even outside of OMPT that share with us?
Well, whew, that's a little busy right now. So, like I mentioned, I am part of a new developing doctor of physical therapy program at the University of Memphis. So, I am the director of curriculum. So, currently working on coordinate. So, really exciting about, like I said, I've been blessed to
Mm,
have so many opportunities along my career and that knowledge. And so, to be able to take that and be able to share that with students as well as the community is something I'm very passionate about. And so, with that, threading those things such as evidence informed practice, throughout the curriculum. Professional formation. So you may, if you've been attending the conferences, really helping to be intentional with building the student in regards to not just ethics and regulatory issues, but leadership and what does their professional life look like? Again, where do we or they visualize themselves as they graduate? For us, we do have a thread of rural healthcare because our program will be actually on a satellite campus in Jackson, Tennessee. So with that, we have a strong emphasis on that autonomy and being able to be that person in the community to be a support going from that. And then, of course, movement. So, I can't go past that. So, my training with MTI, my training at WashU School of Medicine in movement system impairments. And so really using movement to guide our interventions, our assessments, our plans, and making that the forefront versus a focus just on using tools is very important. And then, of course, education and learning. So, at the heart of it, as physical therapists, we teach every day. And so really giving them the skill set to do that learning for their professional life, but also helping patients in how they're learning those techniques as well. So very excited about that. I've been fortunate. I'm a I guess it's co-investigator on a $1.6 million grant that we just received in April, where we are developing simulation and physical therapy education courses in area high schools. So they graduate with their PT technician certificate that they can use in area clinics, which in turn can help them get hours for physical therapy if they should choose to do that as a career. So that's exciting. And I think that's pretty. I plan next month to one of my bucket lists were to visit the redwood forest when I was a child. I always wanted to do that, so I plan on doing that in the next couple of months. So that's exciting.
That is exciting. You'll have to share photos once you come back from your adventure. Dr. Meekins, thank you so much for sharing your insights with us today and your passions along this work. I think it is a really powerful reminder that learning is not just about doing and repeating. It's truly about like feeling and evolving and thinking and growing and also adapting and stretching. No cheesy pun intended, but kind of stretching ourselves to maybe spaces where we're a little bit uncomfortable as educators and lifelong learners. So to the listeners, if you're inspired to kind of rethink how you're practicing and teaching, this conversation is a call to action to look into some of the tools that exist in this space and dig into Dr. Meekins' work. But until next time, keep learning, keep growing, keep your hands on and your minds engaged. Thanks again, Dr. Meekins. It was a pleasure.
Thanks for listening to Hands On, Hands Off, the official podcast of AOMPT. Subscribe now so you never miss an episode, and connect with us at aompt.org or at AOMPT on social. Opinions are those of the guests and not official AOMPT policy. See you next time.